Okay, I didn't hear from Larry, so I'm guessing that he might pop up in the virtual room at some point too. So why don't we go ahead and get started? I think we should definitely do introductions. We have a lot of new-ish and new faces at the table. And even though, so we've just established, Khaki, that we don't have quorum today. So.
Well, and I haven't gotten anything from the county yet.
Yeah, we were just saying, I think at their next meeting, everyone should be on there, which is Wednesday. So hopefully we're gonna confirm that tomorrow, make sure that that happens. And then after Wednesday, you all should get something from the clerk of the legislature about getting sworn in.
Okay.
So hopefully we'll be all set for December.
Okay. All right. So I'll start. Emily Schweitzer. I'm the chair of the committee. And this way.
I am Nicole Zulu. I'm Director of Health Planning at Human Services Coalition.
I'm Debbie Barber, Tompkins County Sheriff Deputy, part of the CARE team.
I'm Randy Brown. I'm the Tompkins Community Liaison.
I'm Anna Tamas. I'm a psychologist in town.
Jessica Connor, a member of the CSB and Mental Health Subcommittee.
And I'm Frank Krupa, the commissioner.
Sally McConnell, member of the board and of the Developmental Disabilities Subcommittee.
Mary Hutchins, I'm a member of this board and the Mental Health Subcommittee.
Sheila McKenna, a member of this board and a member of the DD Subcommittee.
I'm Jan Lynch and I'm a member of the board.
And I see that Larry is in the waiting room now.
Oh, geez, thank you.
So we'll go to introductions online. Khaki, why don't we start with you?
Khaki Wonderlick, retired TC3, hopeful member of the CSB and the DD subcommittee.
Great. Larry, you want to do a quick introduction?
Yeah, Larry Roberts, member of the Community Services Board and chair of the Mental Health Subcommittee.
And Stu.
Stu Bergman, member of this board.
With Stu and Larry, you would have a quorum.
Okay. Well, then we do.
It finally counts on
Yes.
Yay.
Great. Okay. So anyone have any additions or deletions to the agenda? No.
Just
Okay.
the one thing I mentioned to Frank.
Regarding the minutes?
Yes.
Okay.
Oh, you said the agenda.
Yeah.
I'm sorry.
No, we'll get there. That's next. So minutes. We're coming right up. Okay, so Jan, you had noticed that there was something that seemed to be missing from the minutes from last month.
Yeah, just the result of the executive session.
Okay.
There's just, we went in and we came out.
Okay, so we will.
I think there was a result.
Okay, so we will, what should we do? Should we vote on these then, or do we need to ask Karin to fix that?
I would hold off because
Okay.
it's pretty significant.
That's what I was, an actual vote. So-
Yeah.
Okay, all right, so I'm gonna table the minutes until next meeting. And we can get the addition of the results of the executive session added in. Okay, privilege of the floor. Any questions or comments? Yes.
One I wanted to raise, just to see if there's any worthwhile discussion. I had, Frank had helped me facilitate sending out an email when the city of Ithaca was determining whether or not to pull funding from Southside Community Center, which that amendment ended up being withdrawn. But I'm just not sure if this warrants a bigger conversation at some point in terms of how we might respond how we might encourage the county to respond if the city is going to pull funding from other such nonprofits that are a staple in the mental health community.
Yeah. We could definitely talk about that. I know in the past, we've done certain things like submitted letters or, a statement of deliberated on what is our positionality on any given topic and then developed a letter to submit, in pro or against some type of action. That was the first thought that popped into my head when I saw that email, that you had forwarded. I wasn't aware of the issue, but I think there's certainly a big case to be made that the human services community values connection with Southside Community Center and has used that connection in a number of positive ways for a very, very long time. So I'm sure there's a case to be made that, so open to suggestions, in the future. I'm not sure if it's something you would want to address in the near term, or if you want to just put a pin in it for the next time something comes up, and remember that we do have the ability to sort of deliberate on these issues and develop positions.
You can go to public comment portion of the Common Council meetings or the city administration meetings, but of course you couldn't represent all of us unless it was decided.
So, think about it.
Yeah, I don't have any action items for it for right now, but did want to keep it in the back of our minds to think about, should it continue to become a concern.
Yeah, I think we should be mindful of it, and maybe if another situation arises, or if the funding for Southside comes up again, then I think we probably respond, because the amendment was withdrawn, as you said. So
Yes, that sounds reasonable to me. I also had an announcement that at my home organization, Northeast Pediatrics, we applied for and were granted a New York State Office of Mental Health grant. So it was geared toward pediatric primary care offices. And so we were awarded a Healthy Steps grant, which means that over the next 5 years, we'll get about $500,000 from the state to be implementing the Healthy Steps program at our practice, which will be giving a lot more behavioral and developmental support for our families with kids ages 0 to 5.
great.
Will that include new staff or what?
Yes, I hope to bring on a new staff member to focus exclusively on the 0 to 5 population.
Great. So will you be providing counseling to counseling or family support to families, or?
So it's a continuation of my overall branch of primary care behavioral health providers. So we don't provide like individual therapy per se, but we provide direct support to families regarding supports around typical childhood development, around behavior concerns that come up, around autism screening, around getting connected with social determinants of health supports, lots of filling the gaps and weird kinds of things.
Congratulations.
Yeah, it's exciting.
Any other announcements? Larry?
The annual mental health conference will be coming up on Friday, the 17th of November. This year, the conference is focused on women and mental health. It will be on Zoom, and I will make sure you all get the announcement so you can sign up to receive the Zoom link.
Great. Thank you. Okay. So chair's report, I don't have anything in particular to report. The discussion related to funded agencies and providers later on this evening will be a reflection of the last conversation that I had with Harmony when we were preparing for this meeting. So we'll cover those things then. And I think we should turn it over to our guests. So Tammy, sorry, catch off guard. Tammy Baker's here from the Tompkins County Homeless Service Coordinator to talk about housing issues for individuals with substance use, mental health, and developmental disabilities. And do we have room and have you brought other?
I did bring a
With
couple.
you, can we make room at the table maybe for everyone? I think that's good.
It's a little light and lively in the beginning of the meeting. Around a little bit.
So maybe the three of you could do introductions?
Yeah, so hi, everybody. So I'm Tammy Baker, the homeless services coordinator with the county. Prior to doing that, I was a property manager of the Ithaca Art House. Prior to that, I started the community outreach program that is hosted by Family and Children's Services. I did that for almost 8 years. And I don't do as much direct service right now, working with the population we're talking about. So I thought I'd invite somebody from the shelter and somebody from OAR that actually do more direct service. So I'll let them introduce themselves.
So I'm Jess Shepherd, Jessica Shepherd. I work at the shelter, St. John's Community Service. I am case manager there. I'm in the process of getting SOAR trained, and I'm also the SPO point person for the shelter. I am a licensed mental health therapist. Prior to my position here, I did clinical therapy at Family and Children's, a lot with the 0 to 5 program there, which is cool. Yeah. And then prior to that, I worked at Steuben County Mental Health.
Thank you.
And it's really great that the shelter now has somebody that has a mental health background because that's new. So
That is new.
Yes, so yay for
Yeah,
that.
and I'm specifically PATH funded, if anybody is familiar with what PATH is, and I always forget what the acronym stands for. It's like Project something, Transition, Homelessness. I didn't do much to it, but yeah,
A
yeah.
lot more impressive than that. Well, fine,
Not-
introduction.
not-
I work at OAR. I am a housing coordinator. We have a couple of different housing programs. One is the Endeavor House, which I believe has been existing for 5 years. Yeah, which is for men, particularly on parole. And we just opened up, I believe it's on year 2, the Sunflower Houses program, which is also for people in like reentry. It's more open for people who are on probation, parole, or have been court involved. We have 2 houses. Each house has 2 separate apartments and each apartment has 3 beds. So we have 9 beds for men and then 3 for women. And then we're also working on opening up a house that will probably be like a 3-bedroom house for folks that are in recovery and are dealing with substance use disorder. So that's a
What's
new
your
project.
name?
Oh, my name's Haley, by the way.
And is the Simpler House specifically for people in recovery or not necessarily?
Not necessarily.
Okay.
We have, we do have a fair amount of people in recovery, but not everyone that's been a part of the program actually has a substance use disorder. But I would say a majority have.
Thanks. So thanks for joining. So one of the first things, so when somebody, I'm going to mostly talk about the beginning of people that are unsheltered. So that's people either living in the encampment or maybe couch surfing. So in order to get assistance, you have to go through DSS. You have an approval process that everyone needs to go to. And when you go to DSS, this is the packet you get. Okay, so I'm bringing this as an example. If we're talking about people that have a developmental disability, they have mental health, or they're in the throes of a substance use disorder, this can be a lot.
Or all 3.
Or all 3, yeah, it could be co-occurring. And this is what you need to fill out of all of this. This is what needs to get filled out. And it's a lot, right? So just in terms of what could be difficult for people to get housed is to go through this and have to do this. It's really, there's probably about 15 outreach workers that can actually go to DSS and help people fill out this form. So that's really helpful. And if you go there and you're actually homeless, you have to prove that you're homeless. So you have to get 2 forms of verification. They have a homeless verification form that usually an outreach worker and advocate has to fill out. So when I was doing street outreach, I would fill those out a lot with people. You can't just self-verify that you're homeless. You have to prove that you're homeless. So that's also could be another barrier for somebody. And a couple other little barriers is if you are, so DSS has to follow OTDA regulations,
right? So these are state regulations that they have to follow. So it's not our county or the city saying, this is what you have to do to get temporary assistance. So if you apply, you need, if you're working or if you have SSI or SSD, there's a state formula and it takes between 50 and 75% of your income. So that's a deterrent for some people. They don't, I mean, it's a choice, you know, you could say it's a choice, but they're not want to giving up that kind of income. Somebody just gave me a story that somebody, did I write it on here? Well, she makes like $1,000 a month with SSI, but they take like $750 a month in order to stay either at the shelter or at the Econo Lodge, is usually the other hotel that they stay in. And if somebody's working, the same thing. They take, there's a formula, and the formula I think is different depending on if you have a disability, if you're a vet, if you're a young person or somebody with a child. So the formula is different. That's why it's between 50 and 75%. So that could be a barrier for somebody trying to get housing. And if you,
Especially because where they're being housed is not luxurious by any means. So it's not like they have their own bathroom. Sometimes the bathrooms are locked and have to be let in. It's not like sometimes when you come into the shelter, you'll get wanded down for safety precautions. So if you're paying $700 and something to stay in a place, there's all of these, why would I do that when I'm not given like, independence in a way? So I'd rather be out unhoused, try to save this money. But then all the trauma that comes with being unhoused can provide like a lot of barriers to people actually becoming housed. Because during that time, they might start using substances or something to treat the undiagnosed trauma or the diagnosed trauma.
and that's part of it too. And in order to get approved for temporary assistance, once you apply within a certain time frame, you need to meet with a CASAC worker, which is credentialed alcohol substance abuse counselor. I think that's the correct acronym. So if that person makes a referral, like if I'm working with Jessica as a CASAC and I refer her to ADC or CARS, if she refuses to follow through with that referral, then she could get sanctioned and the housing wouldn't happen, the sheltering wouldn't happen. Let's say she does the referral and doesn't follow through with the treatment plan, then she could also get sanctioned. So she could be housed for a week and then she'd be back in the street if she don't follow through.
Yeah,
So-
same thing with doing housing searches and also looking for employment.
Oh, same thing for housing and search. Yeah, so there's some specific criteria. And again, this is set by OTDA, but that's where somebody could get housed and then they're back in the street. So if we're talking about people with, mental health or substance use disorder, that's a lot to go back and forth and not having stability. The only low barrier shelter we have is this time of year during Code Blue. And that's a state funded program. And I think this is the 6th year. It's been in existence for a while, where if it's 32 or below or with a wind chill, they have to house people. What they do here is mostly do a congregate site. So the congregate site would be COTS. Right now it's going to be Salvation Army. Do you want to talk a little bit more about that?
It will be Salvation Army and Econo Lodge first floor. The shelter site on State Street will only be for DSS THA approved folks. The Congress sites are going to be, it's going to be tricky because it's going to be irregardless of gender and sexual orientation, but I say that with a caveat of we are talking about, well, what do we do when people come in who are non-binary, transgender, who do not feel safe, because we know that unhoused transgender, especially if they're a person of color, are the most vulnerable, who are at risk for violence, sexual assault, etc. And so that is in conversation of what we will do with that population. But like Tammy said, Code Blue, we can't turn anybody away. Where right now during like the summer, fall, spring months, if you're not DSS approved, because essentially DSS is paying for your housing in a way in the shelter, we can't turn you away, but there are specific, you will be expected to pack up your belongings every day. You might not stay in the same bed every day. You might only want to keep a bag on you. We are talking about what we're going to do for folks who come in with like either their stuff from the jungle or whatnot, like how are we gonna store that stuff safely, putting that into place. But it's an idea of deterring people away from thinking that they're gonna have between November and April a free hotel room. Because that does, I don't want to say the wrong thing, but that can create a personal narrative of like, well, during this time of the month, like I can live this certain way. And then the other type of the month, I'm gonna live this certain way. So we're just trying to figure out trying something different this year.
What they're doing on the first floor, they kind of lodges, they're taking out the beds, the
Like the hotel beds.
the TVs, the refrigerator, the microwave. So they're putting either cots or mattresses on the floor, have 4 or 5 people in each room. I'm not sure if there's going to be a door still, if they're going to take off the door.
No, there's gonna be a door
There's gonna be a
still.
door, okay.
Yeah, and we're only like putting couples with couples in,
Okay.
people with pets with. I feel like it's gonna be a lot of trial and error.
Yeah, it is.
But the shelter also provides case management. So even if you're staying under code blue, they have a lot of support. I think you have 4.
Right now, we have 3 full-time case managers, and then during cold weather, which is gonna be November 14th to April, mid-April, we're bringing on 2 seasonal case managers. So there should be a decent level of support with trained staff who are trauma-informed trained staff, ideally. And then we're also bringing on seasonal client care specialists is what we call them, who are gonna be both at the Econo and the Salvation Army to take care of like kind of day-to-day, what you have to do and to keep, I don't know, a residency running.
Still a really big population though.
Yeah, it's a big population. So that's a
With
little
a lot of trauma.
You have numbers for approximately?
Last year was 200 and.
the 206. Yeah, it was like at the top, it was like 240, 250. But
And right
normally,
now we're at 58.
Yeah.
So in the next month, it's gonna.
Drastically increase.
and it may be lower this year because of the congregate site. Pre-COVID, what they did is they had people in Salvation Army and there was a church up in Danby. And they had the people in the Econo Lodge and they would rotate them like every 3 days. So people would drop off, staying at the hotel, you have a shower, a TV, so it's a little bit more inviting. So that was a way to make sure they just circle people around. So this year is mostly congregate siting for the code blue. So I want to pause there with that and then talk about, we have a couple different philosophies. So we have the OTDA philosophy through the regulations through DSS. And then we have the Continuum of Care put out our Home Together Tompkins plan, which is really very housing first oriented. And housing first philosophy is everybody has a right to be housed. Everybody's housing ready. You provide the supports and they will access them when they're ready. So our personal belief is I don't think everybody's housing ready. I think it's a spectrum. I think that some people are totally housing ready. Some people need a little extra hand-holding. And some people, if you're in the throes of untreated mental health and or with a substance use disorder, being housed can be really tricky. When I was property manager at the Art House, 13% of the people that were evicted came from the shelter system and went back. There was a percentage of people that left because they didn't feel safe. As a property manager and actually as a outreach worker, I know the plethora of services that are available. So I would talk to somebody, I'm going to say you, Jan, because I know you say Jan. And if you keep stealing people's packages, it's going to end up in lease violations and you could get evicted. What supports do you need? Or if I see that you're coming in, for me, I didn't care if somebody was using drugs or if they were drinking, but if that behavior made it unsafe for themselves and other people there, then that becomes an issue. So I would address that and see what sort of services. And just because somebody's housed doesn't mean they're ready to access services. You're ready when you're ready. So the housing first philosophy doesn't quite work with OTDA either, because there's all these hoops you have to jump through in order to get housed. You want to say something about that?
No, I mean, my side probably said no.
Okay. And so basically I just wanted to talk about that. There's a distinction between what housing first is and what our community offers. And so there's places where they align and some places where they don't align. We had a bunch of money coming through during COVID. It was emergency service grant COVID money. And we housed, oh my gosh, I think We housed quite a few people with that. See if I have that in this one report. So when a bunch of money comes through, it's fairly helpful. Yeah, here we go. I would call that a housing surge. We had all this money coming through from the state. So we housed, this is from DSS, 304 people, 168 adults without children, and 50 head of households with 86 children. 72% of the recipients moved into or remained in permanent housing. So that was really successful. And I'm going to leave some of the copies here. This is emergency shelter information. So we have the shelter, we have advocacy center for people experiencing domestic violence. But this shows how many transitional housing places we have.
That gets a little tricky because people experiencing domestic violence at the advocacy center, I don't know if anyone's familiar, but they get really specific with who meets that criteria. If you're experiencing domestic violence from a family member, you don't meet the criteria for their emergency housing. So I just think that's important to say because it may show that like while our community has a bunch of these resources, it can get a little finicky with like who actually is being served. That was just a plug.
Okay, great, thank you. And then we have permanent supportive housing units. Permanent supportive housing is HUD focus. It's low barrier, and it's really serving people that are homeless. So example, the Art House, there's 123 units, 40 were set aside for 18 to 25-year-old homeless youth. It comes with supports. Permanent supportive housing is not a compliance-based program. Everything's paid for. You're supposed to meet with your case manager once a week. They do a home and health inspection once a month. If you don't engage in any of that, you're still housed. Right. So that's my little bugaboo with Housing First. It seems like accountability, some sort of accountability needs to be built into the program. I really, as a property manager, there was a lot of damage done to some of these properties, not just the permanent supportive housing, but other properties, other units as well. So that's a concern about how do we incentivize and build in some accountability for people. So I'm going to leave. So we have permanent supportive housing, which is the Amici House, which is youth, the Chartwell House, which is for men in recovery, the Corn Street Project, which is TCA for youth with children, Magnolia House is for women. Is it just women still?
Just women.
Just women. Then we have the Art House, we have the Learning Web that has some scattered sites. So most of our permanent supportive housing is for youth that we have locally. And now we have the Salvation Army. It's called, they're using it's Founder's Way. There's 13 units over there that are permanent supportive housing. And then Lakeview, West End Heights has 18 units. And there it's 10 are for people experiencing mental health, 6 are for people with a substance use disorder, and 2 are for people that have HIV or AIDS. And again, it comes with supports, but it's not a compliance-based program. So as a property manager, I think what's really helpful is for the property manager to work closely with the permanent supportive housing case managers. Because as a property man, I did that at the Art House. As a property manager, if you have 12 lease violations, I could move to eviction. But if I work with you with your case manager, we could come up with a plan. Right. So there's that. It's like, so no more lease violations. You meet with your case manager, you do the home and health inspection. Like they're really here to help you so you can succeed in the next phase of your life. So that's one way that I think that property managers and permanent supportive housing case managers can work together. And then we have, we have St. John's. Do you still have SROs?
Yeah.
We have 6. Yeah. Then we have the Rescue Mission, which is a Court Street Men's House. They have 10 units there. And the Second Wind Cottages has 18 cottages for men.
They're opening up their Dryden.
Yeah, the Dryden House. So there's about 111 coming down the pike. We have the Dryden House for women, which is part of Second Wind Cottages. And the Asteria project is happening right over here. That's another Vecino project that's who owns at the art house, there's 40 set aside units for people that are chronically homeless, not necessarily for youth. So that's going to be happening right over there, probably in the spring. And there's a few other that are coming down the pike. So I'm going to leave some of this here if people are interested in looking at that.
So place to stay.
What's that?
Place to stay.
Oh, place to stay. Oh, right. That's in here as more of a transitional. So there are some transitional housing too. The Catholic Charities has a place to stay, and that's just for women. I don't think they allow children.
No.
They don't, right?
Not even for visitations.
And it's not accessible.
What's that?
And it's not accessible.
Oh, and
But the
it's
Dragon
not-
House is going to allow children.
And is it acceptable?
Oh,
Like wheelchair is,
bus, but yeah.
no, like wheelchair access.
Yes,
Yeah,
yes.
yeah,
they
wheelchair
are,
accessible. Yeah,
'cause
yeah.
There's gonna be. I think they're trying to set up 2 apartments that are for women with children. And then 2 for disabled women. I believe they're still in the works, that they're predicting April, maybe
Yeah.
the construction will be done, but it's still up in the air.
And so does anybody have any questions before I can stop, or I just see if anybody has any questions? I thought, yeah.
With youth trying to seek services, is it for homeless youth? Is it similarly going through DSS, or are the main pathways in through SOA or Learning Web or Open Doors Family and Children?
It's a good question. For the permanent supportive housing, they have to come off the coordinated entry list. And that's also,
How does someone get on the cool?
so there's so many, so,
Human services.
yeah, well, the case managers at the shelter, they're called the VSPDAT. So it's a vulnerability score. So you could be on there for like 2 years and all of a sudden Haley comes and her vulnerability is higher. If something comes up in a permanent supportive housing, she would be referred first. So the coordinated entry is housed in Continuum of Care. Simone Gatson is the coordinated entry lead. And so people that are in the shelter system,
It's basically an assessment.
it's a basic,
And
yeah,
anyone who's in like a nonprofit or in any sort of housing authority program is trained in the VSPDAT and the other 2 intake forms, and they get uploaded for like electronically, and then there's a monthly meeting of going through names of who is unhoused and what their status is and who has eyes on them and what is being like where the needs are being met and what are the barriers. It's actually pretty cool.
Yeah, and it all goes into the HMIS system, which is, what is the acronym for that?
Don't know.
homeless, it's called Homeless Management Information System.
Oh, that's.
But the thing with the coordinated entry, it's very specific for permanent supportive housing. So let's say something came up available. Let's say at the art house, it wasn't the 18 to 25-year-old homeless youth, that wouldn't show up, that availability wouldn't show up at the coordinated entry. It's very specific for permanent supportive housing units.
Just like the turbo.
Right, except, yeah, right, yeah. A lot of nuances. Stu and then.
Interesting, the complications, I'm hearing it loud and clear, but the 0 degrees where people are allowed to be in housing without having to interpret this following rules.
We're engaging, yeah,
Right. The other 9 months of the year, when it's really cold, they know the system is good. And you have, what about 49? You have to 200. I heard threads of you're trying something new. I'm not quite understanding what that you're going to be doing that's new. Besides, I think you're new to.
I am new. Yeah. This is
Right.
gonna be my
I mean, it
first school,
sounds like, your knowledge is
Yeah.
going to be helpful for this. And then part 2 of this, I mean, this isn't isolated to Ithaca when I.
Sure.
Grandkids out in Los Angeles and, you see what's happening out there as well.
Sure.
So are they having, different ideas on how to deal with the homeless?
So I think the idea, and I don't like to use the word comfort in this, and yet I'm using it because I think everyone, a fundamental human right is to feel comfortable and to know where they're gonna lay their head at night and be safe. But I think the idea of making it congregate and taking TVs out of hotel rooms and making it less like a hotel situation is so that people don't fall into this idea that they can like use the system, that that's a big stereotype, right? And a lot of stakeholders may see it in that way, but if you're on the floor and doing the work and working with these people every day, you'll learn that it's not a use of a system and it's not a choice, that there's a lot of complexities that go into how this person ended up where they are and trying to use a system that was never really established to help them. It is essentially a system set up for failure, and I hate to say that, but I think it's important to recognize in that doing the best that you can to encourage people to kind of break out of this idea that they were put in. It's very tricky, it's very complex, and I don't think there is like a perfect solution, right? Yeah, I don't know.
And the financial aspect of it is super hard.
And
Because of what is expected for people to pay out of pocket if they are working, it's nearly impossible for them to also provide for themselves each month and also try to save to get their own housing.
And let's remember how expensive it is to rent in this town.
Right.
We deal with this every week where, do I get a job? I meet with people I'm offered this position. Do I get a job? Do I have to work minimally so I still can get benefits and be eligible to stay here? Because if not, they're gonna make me pay $882 a month to like stay in this shit house.
Right.
Sorry for swearing, but like, it's not.
You get $1,000, $700 has to go one place, you have $300.
Yeah,
Somebody does the math and it doesn't add up.
right. They lose their food stamps, they lose any sort of like temporary assistance that they get, and
Because if you make
It's
like
like
dollar
so-
over 400, you don't qualify for it.
so it's a weird system trying to navigate.
I know I've been working, look, Randy, you had a question back there?
Oh, yes, you talked about all the various locations and places where housing can be found. Is that data you provided to the legislature?
Yeah.
So.
That's the housing inventory.
Committee?
Yeah.
Okay, so I just want to get sure that. Also, you mentioned for Code Blue that more than one person can be in a hotel room?
This year, this year they're making just the first floor be the congregate site. So last year, it was a normal hotel room with the microwave and the fridge and the TV. But this year, the first floor, they're taking out beds and putting cots in there.
Okay.
So,
So more than one person?
yes.
Up to 4 or 5, such?
And it's a choreography because some people don't get along. And if you get there and you're high or whatever's going on, you don't want to be next to Jessica, but this is where they're putting me. So there's a lot of navigating. So I give kudos to the case managers doing that
It's a
work.
small town.
Even it's a small town, and even it not being Code Blue, I'm getting messages all throughout the weekend. I can't be around this person. You gotta move. It's just a lot. It's Tetrisy, like playing a lot of Tetris, and also doing the best to meet people where they're at. And we are harm reduction. We don't shy away from people who are using drugs or high, and everyone is like Narcan trained, and there is policies of like, if somebody seems like they are overdosing or at risk for that, what to do. And yeah, it's very tricky.
Can I ask, you mentioned this 50 to 75% range of your income goes towards, being in the shelter. Do you have any sense where that comes from? Because typically when you talk about like percentage of income going towards housing is 30.
30%, yes.
Yeah.
It's a really good question. It's a state regulation. It's OTDA. So
Okay. This is state.
right, one of my goals, what I'd love to see is to have OTDA come to meet with DSS, to meet with me and the shelter. And let's look at that. Because I've heard that different DSSs interpret the regulations a little differently. And I don't know that because I haven't met with it. I've actually talked to a couple other DSSs, but I'd love to have us all at the table together to see, is there any, can we tweak this at all?
Yeah.
OTDA,
Office of Temporary Disability Assistance.
you said different DSSs, like out of state, in the state, out of state.
So I'm just talking about within New York State. OTDA regulates all of DSSs. So and every county has a DSS, Department of Social Services.
Right.
And each DSS can have different regulations. Is that within New York State? I don't know that. I don't know.
I just think,
I don't
well, there's a couple different things. I think that as anybody, if you have regulations, somebody could interpret them a little differently. So I don't know how all the other local DSSs are interpreting the regulations, but it'd be interesting to sit down with somebody from OTDA, with our local folks, and just to have that conversation and just try to understand, is there any flexibility?
I will say the reason also they're so strict is because they're expected to be 100% accurate. So when they get audit, if there's like even that slight percentage, that's why they're so strict about it. Because they have that expectation on them because they're getting state money. So
Probably a lot of it is tied back to the federal regulations, so OTDA probably doesn't have a lot of flexibility. But I know with other state systems, and we've certainly experienced with employment systems where the rules and the regulations are applied extremely unevenly between catchment areas. So, could be that you have a hypervigilant DSS unit that maybe there is flexibility, but it's hard to say.
I would love to see somebody sitting out there to actually help people fill out the paperwork. So it's just more welcoming and not so
you can
intimidating.
actually request that if with reasonable accommodation, they
Yes.
are required to do that.
Yes. And I just think even when somebody gets housed, this population, so think about it, once you get housed, you often don't have anything. Let's say you have a subsidy, Section 8 subsidy, or you got an emergency service grant, you're housed and usually it's an unfurnished apartment. So there's nothing there, right? There's no shower curtain, there's no fork, spoon, knife, pillow, blanket, pot, pan, but your house, so it becomes a checkbox. So that's another way we set people up to fail. And especially if you have
Housing authority will do an Amazon wish list for people, but even that is still.
the housing authority, no.
And also we do the reuse voucher
Right.
too, but again, still limited amount of money, usually for a single adult, it's
Right.
typically $180,
Right.
which again, it's not much, it's something, but it's not enough.
So
You guys are learning from each other.
So I think that's also a
Takes a village,
consideration.
it turns out.
So I just think that's a consideration when people get housed. It seems like it's really great they're housed, but if you're in the throes of addiction, you're in mental health and you're in this empty apartment and an empty apartment can seem echoey, right? So you often go back. And I think often what happens, especially if you come from the encampment, they're still your friends. So you want them to come and visit you.
It's very much a lifestyle, or
Right.
become a culture.
But it's hard to understand that you're actually responsible for your guests. So you may not be causing problems, but your guests may be causing problems. So again, I think that every affordable housing, permanent supportive housing has to have a case manager on site. Property management has really changed given the way the drugs that people are using now are very different, even from when I started doing the outreach work in 2015, right? Scrambling people's brains a little differently. So you get housed, it's a lot. So having somebody actually walk you through, show you how to use a dishwasher. Isn't it cool? It has a dishwasher, but what if you never used one before? It doesn't mean anything. So how to get somebody set up to be with them for the first, at least the first month, 2 months to make sure everything's going okay.
With the Isha units at Weston Heights, they did come fully furnished, like
Right.
silverware, microwave, they came fully furnished. Which was wonderful, it was beautiful. But again, the other part of the units that weren't Isha or SPOA didn't have that.
Right.
Yeah.
So it's just complicated. I think what we don't have is intensive wraparound service, intensive case management, which I think is really needed. And I think that if you really work with somebody and you get to know who they are, you can help tap into their motivation, like what motivates them to do something and to help them stay housed. It's just not easy housing this population. And I know I was working with Harmony. She's got the LGU opioid settlement. And now I think Russ Milne is working on that. So people coming out of the emergency room or maybe coming out of the behavioral health unit, and if they're homeless, they just get sent back down to the shelter. They aren't mental health providers. Now but you're not there 24/7. So I know that Harmony is working on that. So where do we house people so they have support when they're coming out of the emergency room or coming out of behavioral health unit? So that's just sending them back to the shelter is not necessarily in their best interest or anybody else. So I know there's exploring, does it make sense to put them to do an SRO sort of situation, a single room occupancy? Is it better to rent a house and you have maybe a house manager there? So that I don't, they're exploring. I've been working with Russ and introducing him to other different workers in the area. So to
That is what
explore.
they're doing at the Dreading House. They're having a
What's
house
that?
mom. They're having a house mom at the Dreading House, who's actually someone who did live in the jungle. Who's
Oh, right.
now, yeah, and now is a wonderful peer
Yes.
advocate.
Right.
And is living in the house, being a house mother, and someone who actually understands and can be like, hey, I get what you're going through, and actually know.
Right.
I mean that. So wonderful. Excited for that.
And this one anecdotal story, and you've sort of verified it, but I'm still trying to find if it's proof. There's a homeless person and this person's blind
Mm.
and got a voucher to move into the SRO over on Third Street. And this person wasn't able to, again, this is just a couple different outreach workers told me that this occurred. This person wasn't able to get out of the building in a timely fashion for like a fake fire drill. So they weren't able to house him. I don't know if that's true or not, but I've got two different people saying that occurred. What's that?
Same, yeah,
You've heard that? Yeah.
I've heard that.
And so this person has
And I work with this
SSI.
person every day,
So has a disability, so gets taken advantage of every month when they get their check. And is sleeping in the driveway of the shelter. So.
And his option was this month to pay $662 to stay in the first floor of the shelter, which is not his own space. Or to try to like tough it up for another month, save his SSI money, somehow not use drugs along the way and stay uncomfortable and try to get into an apartment next month. Yeah.
Barry?
That seems completely ridiculous. Seems to me that it's on the it's the responsibility of the SRO management to train the person how to evacuate the building. I'm sure there are blind people in New York State who live in SRO.
I do know at least one other blind person lives in that.
Yeah, so I don't buy it that they shouldn't have been able to evict him because he couldn't comply. So I don't know whose responsibility it is to liaise with Lakeview, but somebody should immediately, because there's got to be tens of blind people living in SROs throughout New York State, if not hundreds of people. So that's completely unacceptable. And I'm shocked that the response to this person is to just leave him struggling to find a way to survive. So Frank, if it's nobody else's responsibility, I think you need to intervene to make sure this situation gets resolved, because Lakeview has a contractual responsibility with the state to provide housing to people. So this is outrageous. It's completely wrong and outrageous and needs to be resolved.
And this is, my guess is there's a nugget of truth in there.
Right.
I haven't met the person. I've just heard it from two different people. You were aware of this as well. So I only bring it here. So if anybody can lift that up and assist with that.
Whatever the truth is, and I'm sure it's more complicated than it looks. There are people in this town who have the ability to resolve the situation, and it needs to be resolved immediately. And I'd like to hear next month what the response was. It just seems completely outrageous if there's any truth to this situation. My question, Tammy, is in your role as with the county, what's the best way for us as a community services board and members of subcommittees to be communicating to the county about the needs of people with disabilities in the community who are homeless or at risk for homelessness?
That's a good question. I would say it's me, but I'm leaving this position. On the 15th is my last day. So I would say it'd be me. So I'm not sure, but I will look into that and I will talk to Frank about it and maybe we can set that up. So there is a point of contact.
Okay. I'm sorry you're leaving. I hope you're leaving for something you will be good at, which I'm sure you will.
Thank you.
I was very excited to hear that you were taking this position.
Thank you, Larry. So I think on a positive note, I mean, it's heavy. There's a lot. There's the severe service need population is a lot to work with. There are a lot of outreach workers. And so one of the things I've been doing in this role is to figure out how to get the outreach workers to talk together. Because I could, as an outreach worker, meet with you and then Haley runs into you and say, hey, did you introduce and did you fill out forms? Like, I don't know what I filled out. And then the same conversation with Haley, because she runs into you later. So there's more communication. So if I fill out forms with Jessica and she provides an ID, I can upload it onto a shared platform.
Well, it's the HMIS.
Yeah, so the HMIS has a multiple.
Yeah, so that's not big. So HMIS is a homeless management information system. You have to have a license to access it. But it's you have to, if I was homeless and Jessica's working with me, I have to decide that I want to fill out the information. I can say, no, I don't want my information in there. So then that's not going to happen. So it's not 100% accurate because, and it's also self-reported. So I could say, I know I got evicted because I stole a bunch of packages and I was using in the lobby. But she asked me, she'll say, no, my landlord was a jerk. I don't know why I got evicted. So it's self-reported. So it's not, I mean, it's data for sure, but it's not 100% accurate. So I think but yeah, that could be the platform where, so if you're working with somebody and you lost your ID, it's like, oh, here's your ID. It's in the system here. So trying to figure out how to utilize that.
We have the coordinated entry meeting, so we are able to discuss.
Right.
People, figure out where they're at, who's working with who, like, hey, have you seen this person, which is really nice to.
How often are those meetings?
Once a month. And it's pretty long. It's
really long.
Yeah. Well, like the list is like long because they will go over youth first, then the whole population, and then it kind of goes higher and then also vets. So yeah, go over different.
Well, it is helpful with the coordinated entry because if I'm working with Jan and I haven't seen her in like over a month or so, but Haley's like, oh, actually she stopped into OER. I ran into her. And so we can provide those updates that way. Yes.
Anyone else have any questions? Any more questions online? Anything else that you wanted to share? That was really fascinating and interesting and scary, but very useful information. Thank you so much.
Yeah,
for
thanks
sharing it.
for inviting me.
Thank you for this.
Scary.
Is anybody,
Scary, the system is scary. Yeah.
anybody interested in looking at a DSS packet? I can leave it if anybody wants to. Okay, great.
No, I don't want the packet. I want the.
Okay, great. I'll just leave all this here. Looks like Randy wants to look at that. Okay. All right, thank you so much.
Yeah, thank you.
Fun to see all these familiar faces.
Yeah, nice to see you, Tanya.
Yeah, you too.
Frank, do you have an update?
Yeah, I'll be really quick. First, I think we've covered it, but thanks for all pushing. The clerk of the legislature did confirm that the disability is a reason for not being in person and being able to count the quorum, and that there was nothing, the county attorney confirmed that there was nothing additional that needed to be done for us to be able to enact that. So we are now able to go forth.
Great.
So good news on that front.
That's great.
The other thing, just a couple of construction things. this building, the HVAC system, I told you they've done a complete revamping of it. We're about 3 to 4 weeks from that being completed. We've had some temperature problems because they've got to balance the system out, but they worked on it today. They've got somebody, they're flying in from Dallas on Wednesday. So we're hopeful that we'll be good. This room is comfortable and we can actually hear ourselves. So there's obviously an improvement in this room because we don't have the fans running anymore. Some additional construction projects, the first floor, there will be some changes to that front system that our front desk sit behind in order to make it more secure. There'll be stronger glass going in, better framing to hold that glass, and they'll be readjusting the front so that you can't climb over the top of it. So it's all just additional security being added to the first floor. And then the construction at Brown Road will be starting Thursday to turn the cubicle space that's there in our old home care wing into offices, which will become licensed mental health space when that is done. There's an additional 2 phases on that first floor to essentially turn all of our cubicles into offices. So it's gonna be about 3 to 4 months before the entire project is open, and we'll be able to start the licensing process for the space, but it's beginning Thursday. So we are actually going to see something happening, which is always exciting. So those things are all ongoing, and we'll certainly keep you guys updated. I did mention last time that Genoa is open on the first floor of the pharmacy. They're not fully open. They're still working their Medicaid part out. Once that's complete, then they'll do a grand opening to the community as well for that. That's all that I have.
Mental health component.
Apartment building, yeah.
So clients are gonna be seen?
Yes, yeah, we have seven therapy spaces, meaning offices, a group room, and a nursing space. And we're also building in a space for billing and admin to be self-contained there. So we're hopeful, not day one, but our plan is that everything that's offered here will be offered there as well at some point.
Is that an expansion or is that?
It's really a relocation, and there probably will be a little bit of expansion as we go. The initial focus is going to be on children and youth up there, trying to get that settled. And then once, we move through that, then we'll be looking at how we might need to expand. Initially, it's going to be relocating some people from here. But I think over time, we're hoping that it will show that by being there, there's more demand at that location and will justify expansion.
Is Brown Road affected by the changes in busing service?
I doubt it because the airport bus route goes right by. I did convince them for a short period of time to actually come into our place and drop off at our building, but there just wasn't enough demand for that. But we did get curb cuts put in, and there is a bus stop out at the main road. But yeah, I think there will always be a bus coming by because we're across the street from the airport.
Good.
Yeah.
Larry?
So first I want to apologize for being a little overexcited about the homeless blind guy, but I just say it would be nice to know, Frank, what the outcome of the situation is. It does seem really unfortunate that in a town where there's so much service that this person is having so much problems, some of which can be self-generated, but we know the system well enough to know that there are all kinds of obstacles that get put in people's way. The other one, I have some concern about the status of the outreach workers from Family and Children's based on some stuff I've heard in a meeting. So can you talk about what you know about, are they providing the same level of service? Has there been changes? Are there problems?
Sure. So there's been a lot of information floating around about this, and I think there's a lot of misunderstanding about what has happened. So Family and Children's for a long time has been running the community outreach worker program. Tammy was the very first one. It was constrained to the downtown Ithaca Commons area. Over time, the legislature added funding to that to add a second position. as well. So that got brought in. Last year, Harmony went to OMH and was able to secure a year's worth of funding to expand that community outreach worker program to the rest of the county. It was 1 year's worth of funding. We have gone through the legislature and asked for funding, and they have included it in the budget for us to continue that outreach worker program into the county part. In the meantime, there was no funding. And so the staff knew there was no guaranteed funding, and they went and got other jobs. Most of them, I think, went over to Reach. So there's been this, I don't know what the thing with Family and Children's is, to be honest with you. I keep hearing that, and the program that they put on for us with the outreach work money that Harmony got from OMH loved the data that they got. They loved what the program was able to do. They loved the number of people they were able to serve and the number of contacts that they had. That is the first time this department has ever been involved in outreach workers for the county in any way, shape, or form. So there is a systemic challenge. There's a systemic challenge with the outreach worker programs because there's many different agencies that have them, and we're now trying to figure out how do we fix that. And Tammy was going to be a component of that, but with her departure, it's going to complicate things a bit. But from the Family and Children's perspective, we're having internal conversations about the county funding, both the two positions that are downtown and the two positions plus a supervisor that would be in the rural part of the county. We expected that would just be one big program. That's part of the reason we went with Family and Children's. We also went with Family and Children's because they're a licensed OMH provider and the money was coming from OMH. And it was the place that the county, the city, and DIA put their monies initially. We're having some conversations. Harmony's reaching out to Family and Children's to kind of find out their interest about the program moving forward. It is our intent, if we as a department are going to be involved, that it be a comprehensive program that actually works. And that's going to be our expectation. So we've met with county admin and Tammy to talk about those other two positions and what the intention is with those. The challenge is those positions are funded by three entities: the city, the county, and DIA. So it's not as simple as just county money in that, but we are committed to figuring out a plan that will work so that we have 4 outreach workers with a supervisor that can cover the entire county. That is our plan. Whether we stay with Family and Children's or it gets RFP'd, all of that is still kind of under consideration. And of course, the legislature hasn't finalized the budget yet. So there's not actually a guarantee, but we're 98% sure that it'll survive their final vote. So that's kind of where we are right now. I'm trying to find out where the stuff is coming from about Family and Children's beyond there just being some misunderstanding about the program falling apart. The program fell apart because there was no commitment to ongoing funding. And if you're an employee and you know that, you're going to go look someplace else for long-term employment. And that's ultimately why there was no staff left in that program. It wasn't a failure of the program. In fact, the data that we have was very, very promising from the 2 outreach workers that were out in the community beyond the city of it.
So at this moment, the existing program is the people who are in the downtown catchment area, right?
I didn't catch the question in there, Larry.
So right now, the program that exists is just the downtown outreach workers. There are no outreach workers from Family and Children's going into the rural areas.
Correct. That is my understanding.
Okay, thanks. And thanks for following up on it.
Yeah.
Could add to that, Frank, because I did meet as the director of the Rural Health Network for Tompkins County. I met with the team and they were a wonderful, passionate team. And I think it's about sustainability. So if there was a continuation of funding, I am certain they all would have stayed around. And so anything I can do as the director of the Rural Health Network, I offered my help in that too, with, showing the evidence of why we need those type of workers in our community that are serving the rural areas.
Yeah, I think the data is clear on it, and the legislature has been extremely receptive to that as well. So I don't think so much it was convincing as timing
Yeah.
of when the other funding ended and the legislative process occurred and everything that goes along with it. I will say though, and Randy's here, but I will be having conversations with the county administrator and the legislature in the coming months post this budget, that we have a situation brewing in a couple of years where we have several positions, including the care team, that are funded with one-time funds over 3 years. And so we're going to be faced with some really difficult sustainability questions for programs that I am confident are going to be successful, because we're not going to do them if they're not going to be successful. And we're going to have to decide, do we have the funding to sustain those? And that includes the care team. It includes these outreach worker programs, all things that have kind of built out of public safety reform, trying to find alternative approaches, but they're very expensive and they don't necessarily generate revenue. So it becomes a county responsibility, and we're riding on one-time funds right now. And so we're going to be in a situation where, the legislature is going to have really difficult decisions, because we're not the only department in that boat, right? That there's a lot of others, but we are paying for positions with one-time funding right now that I think we're all going to say when the time comes are extremely important, need to continue, but we don't have a path yet for sustainability.
I imagine that's going to impact hiring people, right? If they know that, they may not have a job for 3 years.
Yeah, well, I think 3 years gives us a good window where we can bring people on, and that's why we're going to start the conversations now, because we don't want to start them when the money's going to run out in 2 months, and then we have this problem. So we're going to try to get ahead of it to make sure that we know which programs we're going to be able to sustain and which ones we might not. Now, obviously, things change, right? The financial situation for the legislature and the county could change. A million different things can happen between now and then, but I just want to make sure that there's clarity around that cliff that's coming, right? So that we're all aware of what we're doing, because we're going to have some really great things coming out of these programs. We've already heard from the care team in just the short time they've been operational. And we know the outreach worker program has put they've put data on the table that shows that they've been successful and have helped. So the question is going to be, how do we sustain those long-term financially?
Tammy's position, has that been posted or?
I found out Friday that Tammy was leaving her position, so I was hoping she might share some more tonight, but I don't know. I don't know. I'm assuming they will post it soon, and try to refill it. Yeah, but I don't know any details. I'm sorry.
It is in the budget though.
Yes, it's in the budget.
Any other questions for Frank before we move on?
Sorry, I said short.
No, that's okay. No, it's all right. It's important. Mary, I see you have an application in your lap, but I don't see anything on the agenda about nominating committee. Did we miss something on the agenda? We should have had it.
Yes, we should have an executive session.
That's what I thought.
Yeah.
Okay. So I'm going to suggest, since we're running short on time, that we actually just go into executive session and have the conversation about funded agencies on subcommittees next month, because I know also Harmony has a lot of thoughts about this. So it'd be nice if Harmony was here for that conversation. Anyway, that's okay.
I wonder if right before that, we could just give Debbie a chance to talk about her interest in applying to the CSB.
Sure.
Yeah.
Okay, thank you. I'll make it brief. So, the administration for Tompkins County Sheriff's Department thought it would be a great idea to have a representative for the Sheriff's Department on the board. And I thought it would be a good idea if I would be the representative, since I'm out there with the care team and pretty much have an eye on everything going on. And hearing Tammy talk, just really, a lot of it was, yes, this is what we're seeing every day, or this is what we're seeing out there. So it's nice to be able to put it all together, put the pieces of the puzzle together, and hopefully together we can all collaborate and come up with some solutions and some viable options for people to see what we can do as a community to help everyone. So I guess that's my interest in the board, to see what do we have, what are we missing, and how can we put the things together and really help the community that we serve. And I'm out there every day, so I can bring that back to say, this is what I'm seeing, these are the success stories, but this is what we're missing, and see if we can work together to try to bring that.
Okay, that's it. Thank you so much.
You're welcome.
All right, so maybe next time we have an executive session, we won't have to excuse you all, because you'll be sworn in.
Thank you all.
Thank you.
You need to make a motion to go into executive session,
Motion to go into.
All right, second, thanks, Stu.
and it's unanimous. All right, hold on, let me